Over the last 24 hours, we have identified 1,571 new cases of COVID-19 in Alberta and completed about 19,800 more tests. This means our positivity rate currently stands at about 7.9%. There are now 763 people in hospital, including 138 who have been admitted to the ICU. Sadly, I must announce that 30 deaths were reported to us in the last 24 hours. This is a heartbreaking figure. While these deaths did not all occur yesterday, this is the highest figure that I have had the sad task of reporting. If anyone still needs reminding of the seriousness of this virus, of the importance of the restrictions that are currently in place, and the importance of doing everything possible to limit our interactions and break the chains of transmission, this is it. There are now 790 Albertans who have died as a result of COVID-19. The death of a friend or family member is tragic at any time, but I know that during the holidays, we can feel these losses and our loved ones' absences more than ever. I extend my heartfelt sympathies to everyone mourning a loss today from COVID-19 or from any other cause. There are currently active alerts or outbreaks in 450 schools, or about 19% of schools in the province. Currently, these schools have a combined total of 1,966 cases. This number includes 126 schools on the watch list. With Hanukkah wrapping up tomorrow and Christmas and Kwanzaa only a week away, I want to talk today about the holidays. We are 1 week away from the start of a few statutory holidays for all Albertans, regardless of faith or background. I know that holiday plans are top of mind for many people, and I want to reiterate my message from earlier this month. This year we can and must celebrate differently. Holiday gatherings with people outside of your household are not only against the restrictions that are in place, they are also the wrong thing to do right now. I know that Albertans want to do the right thing. The safest way to celebrate this year is in person with only your own household, or with your designated 2 close contacts if you live alone. Celebrations with others should be virtual. I know Albertans will do the right thing, but for some, it may seem like the right thing to do is bend the rules, not out of malice, but perhaps out of compassion. I want to be clear that the compassionate choice is to follow the rules. It may not seem like a big deal to get together with your extended family or group of friends. If you all feel fine, you may think that there is no risk of catching COVID-19 or passing it on to others. But that is simply wrong. We have seen time and time again examples of people attending a gathering with either mild symptoms like headaches or a stuffy nose that they didn't connect with COVID-19, or when they were in the day or two before their symptoms started, when they were infectious but didn't know it. The result has been one case spreading to many. That is how cases rise and outbreaks start. These orders are not recommendations. They are legal restrictions, and for them to be effective, we need everyone to do their part. Thank you to all those who are changing plans and finding joy in different ways this year. Last week, I asked Albertans to share the unique ways they're embracing the spirit of the season and spreading joy. Once again, I am impressed by the generosity of Albertans, and I want to share a few examples that can help to inspire more acts of kindness. Project Joy, an organization founded here in Alberta, is collecting unused smartphones and tablets and providing them to continuing care facilities to help isolated seniors stay in touch with their families. I've also heard many employers have replaced traditional work Christmas parties with care packages and holiday treats delivered straight to people's homes. The Elk Island Regional Honor Choir Association has been practicing on Zoom for many months, so they decided to take their annual winter concert digital as well. I want to thank all these groups and individuals for finding different ways to make the season joyful. This has been a challenging year, and I know this holiday season will be difficult for many people. This is a particularly challenging time for those living and working in continuing care. To help lift their spirits this holiday season and show how much they matter to us all, I encourage everyone to send holiday cards, letters, art, or other shows of support to continuing care residents and staff in your community. This small act of giving can go a long way. It will help spread joy and encouragement during the holiday season and remind our most vulnerable that they are not alone, that Albertans care and are thinking about them, and that we are all in this together. Please show your support to a continuing care facility that's near you. If you don't know where to find them, we have posted a holiday article to help. You can find it at alberta.ca/COVID holiday info, and you'll also find a link where you can search for a facility near you. Also remember that each facility may have a gift policy, so if you're thinking of sending larger items or perishables, please check with operators first. As of last night, 394 healthcare workers had received their first dose of vaccine. I know that many people want to be vaccinated immediately, and that is a good thing. We are moving quickly to make the doses we receive available to those who are eligible, and we will continue to do that going forward. There are about 4.4 million Albertans. It will take time to get enough vaccine to offer to everyone who wants it. Please be patient while we all wait for our turn, and be supportive of those who are in the initial groups to be immunized. We are starting with critical health care and long-term care workers, as well as those living in continuing care, to save lives and protect our healthcare system for all Albertans. These are people who are most at risk and who are putting themselves in harm's way every day. I think it's, as I've said before, understandable for people to feel angry or sad. The common stages of, the well-known described stages of grief include things like anger, sadness, bargaining, denial, before we get to a stage of acceptance, and all of those kinds of emotions are completely natural to feel. The problem is, of course, when people are disregarding the evidence. And as I mentioned just today, we had 30 deaths reported to us in just 24 hours. And so I guess what I would say to people who are engaging in those activities is it's not just that they're accepting risk for themselves, they're actually engaging in things that are risky for the people around them and for their communities. And while I completely understand the frustration with all of the things that we have all lost this year, it is COVID-19 that is the enemy. And that is what we all need to be focused on combating. And so with respect to how I would want these kinds of demonstrations to be addressed, there certainly is a right to be able to have people's perspectives and voices heard. That is important. And at the same time, it is also important that when people are doing that, they not put others at risk. And we do have a document with respect to guidance around demonstrations and marches and rallies. So what I would want to see happen is that the guidance be followed in those rallies where people are showing their opinion and sharing some of those feelings of frustration, but that they do it in a way that doesn't put others at risk.